Hi, everybody. This is Dr. Sham. I'm a rheumatologist practicing in Chennai. So, who are at risk and what are the symptoms which shouldn't be ignored, particularly in a patient with ankylosing spondylitis? So, as I told in the previous video, the most important thing is about the inflammatory back pain. So, morning stiffness, early morning, or alternating buttock pain, these are the earliest thing. Usually, these symptoms are seen in young males, but these days, with the advent of MRI, we also seen a lot of women. So, as I told, the ratio is somewhat 3:1. What we found is actually it's not that less common in women; it's mostly underdiagnosed women. So why it has to be treated like rheumatoid, I told deformity. Here, what happens is there will be a lot of newborn formation. Spine becomes fused. Like instead of having a straight spine, patients become kyphotic. They will have bent spine. You become stooped. So once that posture comes, then it's very difficult. The patients who have severe ankylosing spondylitis, the neck will be so bent that they won't be even able to rest it on the pillow. So they won't be able to even sleep properly in the supine position, like in a straight way. They actually curl on the side. It's really a sad state that shouldn't happen. So that is the reason we have to identify it early. Like rheumatoid arthritis, this is also a systemic problem. So it can involve commonly the eyes. Patients have redness of eye, which lasts for a few days. After a few months, it can affect the other eye. So check with your eye doctor whether it's a uveitis. Even sometimes patients have uveitis, recurrent uveitis. Then retrospectively, we diagnose that the patient have an ankylosing spondylitis or spondylarthritis. Because like other diseases, here also there are patients who will have a mild symptom. Most of us during that engage will be very active. We may not really give importance to the back pain unless it really bothers us. So it can be missed. So it can involve other joints, as I told, like in the knee, ankle, or sometimes shoulder. What we call the root joint, shoulder and hip can be involved. Bowel can be involved. Any recurrent diarrhea, joint symptoms, do think of that. Or patients with psoriasis also, we have to be thinking of it. So young people, low back pain, morning stiffness, think of ankylosing spondylitis, can be associated with other disorder, though more common in males. Females also can have it. Identifying is very important, because otherwise once the fusion happens and people have that stoop posture, it becomes very difficult to treat. So as I again, this slide states again that it's not just about that joints which are involved, it's also about the other organs. Sometimes what happens is patients, they'll have excessive fatigability. People who have very severe inflammation, morning once they get up, they won't be feeling fresh at all. They won't feel like they do anything. So excessive fatigability is one of the common manifestations in ankylosing spondylitis. So other than that, joint symptoms, all the other things have to be like a skin, bowel, all the things also have to be thought of. So these are the things we should see in a patient with ankylosing spondylitis, or if anybody has, it might be joints first, later eyes or skin, or it can be skin first, later joints. It can be either ways. Thank you.